Dr. Laura, you look so gorgeous today. Thank you for joining me here on the show.
Thank you for having me. And you look so gorgeous today.
I feel like we could be related
I feel like we might be.
for those people that can't see. You'll have to wait for Instagram and we'll do some reels on this. That'll be really fun.
We're
So,
cousins.
so much to unpack with you. I actually thought it would be fun to get started by taking a little walk down memory lane to the days when you were growing up in you called it before a one stoplight town.
Yeah. I mean, maybe there's two or three now, but at the time there were not so many stoplights.
And it wasn't, did you say South Kentucky?
Southern Kentucky, like
Okay.
pretty much Tennessee. Yeah.
So walk us through that because there's been so much that's happened to you to get from that point to that small town with now two or three stoplights. We'll give them a little shout out to where you're at now.
What was it like? Okay. I feel like my upbringing was very simple. I don't know exactly the size of the town, but I'll name drop was Russellville, Kentucky. And it's one of those places that a lot of people who are from there, they stay there. They love it there. It was a big farm community. I think it's like the tobacco at the time, it was the tobacco growing capital of the world. And so very farm oriented. There was a lot of sports, like town community sports that were played there. But I had a tiny little class. I want to say there was maybe 60 kids in my class at school, and I was one of them. And everybody went to church. It's a very religious town, and people would know who your friends were and where you worked and what you did based off of what church you went to. And if you changed churches, it was drama. And but but had a very simple life. I grew up outdoors, like playing outside. The nearest town was maybe 30 to 45 minutes away. And it was a very simple, peaceful, humble upbringing. I did a lot of reading, lots of nature, and no sports playing because that is not my gift. But that's how it
That's actually
started.
kind of surprising to me.
No sports.
Okay. You
No.
were more into the science when you were a kid then?
Music nerd. No, I
Oh,
was a
okay.
musician, 100% musician. Science came after music, actually.
So then as a musician, do you play an instrument? Are you a singer? Tell us about that.
Yeah. Well, I was a professional accompanist. It was like a first career all the way up until high school and end of high school. But yeah, I played the piano for orchestras, choirs, musicals, soloists, churches. I was a church musician for three or four different congregations and love choirs. Choirs and musicals is my favorite thing in the whole wide world to play for. I can sing. I would say I sing well, right? Like after taking lessons and being around people who were instructed on singing and being a musician, but I don't identify as a singer, but I like to do it and I'm not bad at it.
Well, maybe we can look forward to seeing and hearing some of that on your Wednesday Instagram lives. Give us a
I
little
love
peek
it.
into that expertise and that talent. Excellent. Okay.
What else? So what came after that, right? So started out as music, and that's actually how I worked in high school. So, well, let me stop there. After eighth grade, moved to Indiana. My dad got a job in the automotive manufacturing industry. So we moved to a suburb of Indianapolis, which was Noblesville. And I went from a school of less than 100 in my class to like 2,000 people, like a massive school the size of a city block with extracurriculars and all kinds of stuff that really wasn't available where I grew up.
And
And
that's a huge change. And how old were you at the time?
I would have been, it was 1999, so 15, I think.
If you don't mind, just for a moment, I would like to ask you, how did you navigate that change? Because when you're 15 and you come from a really small town with 60 people at your school, and probably, you were all in the same classroom for it didn't matter what grade you were in. And then all of a sudden you move halfway across the country. It seems like that could be overwhelming.
Well, okay, so for me, it wasn't actually. And the reason why is because I was very heavily bullied. I was aggressively, painfully trauma inducingly bullied in middle school, and that was part of what encouraged my parents to want to move us to start high school. I say us because I have a younger brother too. And it was so bad that between 6th and 7th grade, so 2 years before moving, I left the school that I was in, trying to get away from the bullying. And so for me, I was actually so grateful to get away. I felt like I felt so powerless. There was nothing I could do. I told the teachers, I told the principal, I changed schools, but everywhere I went, I was bullied because I was different. I was loud. I was smart. I was musical. I didn't play sports, which was an unpopular thing. I didn't cheerlead. I was a little bit more at the time that I wasn't feminine. I wasn't feminine in the way that I dressed. I didn't have a developing body yet. I was physically a late bloomer, and we didn't have a ton of money. So I didn't have name brand clothing and athletic shoes. And I didn't fit into the mold. So I was aggressively bullied. So moving to Indianapolis or Noblesville, I was so happy. And almost immediately I found my community because of the musical. Like, I fit into the musical theater scene in the music scene. So I found that within maybe 2 months of being there, and instantly felt a sense of community. Like I had found people who understood me for once.
What a gift that turned out to be.
Yeah.
Wow, I would have never, ever known that about you. Thank you for sharing. And thank you for sharing what ended up being, your God-given talent already was, it ended up to be an even bigger gift once you moved to help you get through that. Just for anybody out there listening that's ever been bullied before, to know that you feel their pain now, and how you could potentially use music as that gift, as you said, to find your new community and your family, which was probably a pivotal turning point for you, because it could have gone so many different directions had you not found that family or that community after you moved, because you're already at a new school, you're already unfamiliar, you don't have any friends.
Yeah. And this was before social media, right? So now we have a lot, social media gets a lot of shade thrown at it, but that is a way for you or us to connect with people who are like you. And what I learned through that, and then moving forward, is that no one is ever really alone if we are willing to at least put ourselves out there enough to try and find people who are like us. No matter who you are and no matter what you do or what you're like, there will be people out there who share enough in common with you that you can bond with them and have that common ground. So that's one of the things I encourage people is, if you have a gift or a passion or a talent, let that be a guiding light to point you in a direction, to use your term, like your God-given gift, the thing that you were born to love, that can be a kind of a beacon pointing you in a direction for you to go.
Absolutely. I love that. Thank you for sharing that. And look at you now. This is insane. I did not know the bully story. Oh my gosh.
It
So
was
insane and so inspiring.
yeah.
Okay, keep going.
Next, well, so kind of moved forward in the I love to this day, if a stranger knocked on my door and said, "We need a pianist for musical right now," I would cancel my schedule and just drop everything and like run to the nearest
So to Laura's personal assistant who's listening, you better pray
who
that
was a
doesn't happen.
musical theater major by the way. In college, that's what we did, was we sang and played together.
Oh,
So
and your patients who have an appointment.
oh yes.
I love it that you're just being honest. That's how much you love doing it.
I
We
love
have to
it.
like have a film crew now come in, actually ring your doorbell and ask you to do this like in the middle of your tour across the country, and see if you would actually do it.
But there's no question about, I would say, give me the music and let's go. I mean, I was so gifted. So this talent that I received, that I was given, it was tremendous. I mean, I could sit down in front of a piece of music I had never seen before and instantly produce something that people could perform to. I mean, I was very, very, very good. And I wasn't naturally that way. That it was because of hard work. I mean, I would spend 6, 7, 8 hours, entire weekend days in front of the piano, because I had a mentor. Her name was Deborah Whitstein. She recently retired and I didn't get to go to it. So sad. I wanted to go, but she was really hard on me in a good way and expected me to rise to the level of my potential and didn't take any excuses from me at all.
And
So
how old were you when you had her, when you had this tough love?
16, 15,
Okay.
16. I mean, I was
Wow.
young. Yeah. But pressure has never been something that's ever bothered me, right? Like people put pressure on and I say, okay, game on, not, oh my goodness, I back off. So it did that, like worked. I mean, I had like several $1,000s saved in the bank, which is huge for a high schooler. Like that was my job. It was my profession. Like nowadays, if that was my child, I would have been like, you need an LLC. Like, like this is what I would have done in those days. But I had an instance where there was a person who had contracted me to do some work for them over the summer. And it was right around the time when I was applying to music school. I had music school auditions. I was going to do it. I was going to go. And there was an instance, and one of the themes of my life has actually been being bullied as a child and as an adult. And even still today, within the last week, I am actively being bullied, believe it or not. And I did a show with a professional company, and I was bullied out of my position in real time on stage during the show with an audience sitting right there watching me and the lights on and actors on stage. I was bullied out of my position by someone who I had hired to substitute for me while I went on a foreign exchange. They went behind my back and bullied me out of my position. And so I quit that day because I said, if this is what professional music is, I'm not like that. And I can't be a part of this industry if that's what it's like. So I quit.
You took a stand and you weren't going to play small under those circumstances. I love it.
And I would have been 17 when that happened. And yeah, I was 17, cried my eyeballs out, like just was heartbroken. I mean, now I can talk about it and I get fired up, but in the moment I was devastated. I was heartbroken. I didn't understand. These were adults who were bullying me and I was a child. In hindsight, I'm like, wow, I was 17. Like what? Never got paid for like a whole year's worth of work. It was awful. So my dad said to me, why don't you go into healthcare? They always have jobs. And my sister's a nurse practitioner and she loves it. And I said, okay, might as well. What else am I going to do? And I started shadowing nurses. And so I thought it was really interesting because I got to see a couple of instances of how the nurses would work when the doctors were not around, which was great. And then how the doctors would work, or how the nurses would work when the doctors were around. And there was a big change in dynamic. And I realized that doctors have a huge responsibility, not only to the patients, but also to the rest of the healthcare team and to the system as a whole. And I didn't want to put myself in a position to potentially have people who could abuse that power and responsibility being over me, which is really ironic because that directly applies to my life today. Because there are still people in positions of authority over me who abuse that privilege. But I said, I want to go be a doctor. That's what I'll do. And I called up my dad and he said, okay, sounds great.
That's quite a pivot.
Yeah, guess I'll be a doctor. And
You've been pivoting your whole life.
That's all I do. Like my hips are getting sore from just pivoting and pivoting and pivoting and pivoting.
Maybe you should take up golf.
I should go. I got arthritis in my hips from pivoting. And so then this was probably 2003, 4. So I'm like 18, 19, 20, 21. And, the way it works is you do 4 years of undergrad, which I did at Ball State University. Loved it. So much fun. Graduated early because why would anything that I do ever be simple? And, and then, in the early 2000s, I'm sure you remember, it was a very patriotic time in the US. There was yellow ribbons everywhere and war footage on the television and USA fist bumps on TV and everything. And so I said, I'm going to go join the Army to be an Army doctor. So it was like a quarter turn pivot. And my family said, okay, great. That sounds awesome. And I said, actually, I think I want to go to the military medical school. And so I applied to one place the Uniformed Services University. I said, if I don't get in, I'll try again next year because that's where I want to go. They accepted me. I started in 2007, and then I was in the military for 14 years.
And to that, thank you, by the way, for your service and to the military. I really appreciate that.
Well, you know what I say when people say that to me, first it's humbling and it's heartwarming, but I also say thank you for being an American, because if it wasn't for you, there would be no freedom to fight for, and there would be no people to serve for. So thank you for being an American and giving us something to serve for, right?
I love that. Yeah, no, you're absolutely right.
So what's next? Should we keep going?
Yeah.
Okay. So in the military, again, I was aggressively bullied, not in med school, but it started in resident. So, well, the whole story, right? So during medical school, my dad died in my first semester of second year of medical school. He had a chronic disease. It was Crohn's disease, not necessarily managed in the best way, but I don't actually blame his doctors for a lot of that. Like, he was, type A, hardworking, would just kind of, how a lot of people brush their health aside. And,
I hate to say this, but typical guy. So it's really not surprising.
not surprising. And honestly, being a corporate executive role right now, like I am, I totally get it. By that point, he was the VP of this factory, and he had 500 people working for him, and day shifts and night shifts and traveling internationally. And I kind of get it, like living a similar life to him. But he died in the middle of finals week, and the military is not super nice about letting you take time off. I missed the PT test and I missed an exam, and I was out for 1 week. And I came back and they were like, why haven't you done your PT test yet? And when are you going to take your exam? And I remember thinking,
excuse me?
I guess I'll do it now. But this ties it back into what we talked about finding the people who are like you, right? Because one of my very best friends, who to this day is still one of my very best friends, her name is Jen Zuccarelli. Her dad had died in college just a few years before. And she pulled me up by my collar. We were in the same lab group. And she was like, no, we never cheated. We would never do that. But she did a study session with me, and she was like, this is the stuff you need to look at. And I'm not going to let you not go to school. And whereas everybody else was kind of like, okay, just give her space and don't touch her and give her time. And she was like, no, get up. Like, you're still going to be a doctor. That's not how this works. Like, let's go. And I would say that relationship and that bond really saved my education.
Wow. I love that. That takes a lot of courage as anybody's friend to do that, especially given the circumstance that you just described. But it was her love for you, even though it was a tough love at the time. And look where you're at now as a result. I mean, I don't doubt in my mind that you'd still be here, but it may have taken longer, which would be okay. But I mean, that's a good friend. Obviously, there's a reason she's one of your best friends.
100%. I just saw her a couple weeks ago, actually, because it's just people like that who pour into your life in that way. For me, I want to pour back into their lives too, as often as I can.
Well, and that makes sense now when we talk about your ethos about creating an impact in the world, and specifically in healthcare. You can just tell how compassionate you are for others in all that you're doing and all that you've created. And so another interesting time that I wanted to ask you about was when we were talking about right around when COVID started. So about 2.5 years ago, when you were in your living room, just surrounded by all these stacks of paper, you've got patients that need to be seen, and you've got so much that you have to do, and it's just you, and you don't have a team yet. And this was right before you started what you've been doing for roughly about the last year.
Yeah.
You had to give yourself permission to let others actually help you. And in doing so, now you're licensed in all 50 states.
Yeah. Yes, you're right. And so a lot of people, when they see the things that I'm doing, and they raise their eyebrows at me, and they, dare I say, try to bully me a little bit and say, well, how do you, I don't see it. How do you possibly do all that? And I say, I couldn't, I can't do all this by myself. I ran myself all the way into the ground, not because I wanted to, but because I didn't know that it would be okay to ask for help and to find help and to learn how to trust the help, right? Because if you have someone come and help you, then you need to let them help you, not question the help you're receiving, or micromanage
Micromanage. Yeah.
the help you're receiving. Of course, you want to check and double check and communicate clearly, but you also got to let go just a little bit. And your story is correct. I think I had just had a baby or was about to have a baby. That was in, so 2020 is a blur for probably a lot of us. I feel like if we look back, and I had these papers that I needed. Everything was still analog. Now everything I do is digital. And I'm sitting in my living room with like 360 degrees around me. And I had a cardboard box from Amazon that was my desk right in the middle of my living room. And
I wish you had a picture of this.
you know what? I bet you that I have a picture of all the papers, because I remember going, I can't do this anymore. And papers all around me. And I had pens and staplers and folders and like a scanning station, not with a scanner, but with my cell phone. And I'm just like sitting here going, I can't. I need help. And I found someone came to me and said, do you need an admin? And I said, maybe part-time.
That's an understatement.
Part-time, but I didn't know. I couldn't think about what I could offload, but things like scanning and like digitally signing and filing and processing and sending and copying and storing, like, no, that doesn't require a doctor to do that.
I was going to say hours of things you shouldn't be doing.
And as long as you keep the HIPAA, you make sure it's like HIPAA compliant and all of that, which I 100% do all the time to the extent that I am able to do that. And I said, yes. And honestly, that opened up a huge door for me. And I had a boss, his name was Lyle Berkowitz at MD Live, which was the first telemedicine company I worked at. And one of the things that he said to me that I, to this day, use, this morning, I said it to my director of operations in the clinic. He said, I only want Dr. Purdy to do the things that Dr. Purdy has to do. And if anyone else can do it, then I want that work on someone else's plate, like legally, morally, ethically, if someone else can do it. And that's what I do. So over the years, as I've scaled and grown businesses, if there is something that someone else can do, whether it's a nurse practitioner or an RN or just an administrator or personal assistant or a podcast booking agency, if there is something that someone who's not me can do, then I find that person. And in the first 6 months of doing this, I found that the like productivity or the revenue or whatever you like to call it increased by 70%. When I started paying other people to help me, the business as a whole was able to do more because it grows the business. Like as you grow people in a linear fashion, you grow business in an exponential fashion. And I've never seen it work any other way.
You're happy. They're happy. It's a win-win.
Yes. And we have a community. We have a team. We have, it's a workplace. It's a business. It's an organization. It's not just me out there treading water going, oh my gosh, I hope I can get it all done.
Yeah, exactly. And that's how you're able to be licensed in all 50 states. And I wanted to really dive into your program. Just walk us through how that's working, because it's newer and it's not something that, I mean, I don't know how much competition you have out there, but this is a really big goal that you have here. Walk us through it.
No, it is. And I'll tell you, it's really scary because one of the things that is happening right now is that I am exposing discrepancies, biases, judgmentalism, and a lot of archaic legislation at the levels of the state medical boards. I have a giant target on my back. I get investigated all the time. This is bullying, right? I get investigated all the time for not really doing anything wrong, but I do things differently and it draws attention. I can create systems to scale, right? I can find a way to do cash pay and not use insurance, and people are happier and we give them alternatives. So what I have right now is a virtual primary care clinic. It's got me and there's 2 nurse practitioners and a third one is currently onboarding. And I have a massive staff. And right now I'm trying to build it just like you would, literally just like you would in an in-person clinic. Like you walk in and you get an intake form, and then a nurse or an LPN processes you. And if you have a prior authorization, the team helps you with that. Then you speak with the doctor and you get a prescription and you follow up when you need it. And it's this big, kind of team process that flows in a really beautiful way. But the problem is that I'm licensed in all 50 states. Technically, I'm a national physician, but technically each state gets to tell me their own idea of what they think is practicing medicine. And the states are not in aligned. So the definition of safe and healthy practice of medicine differs from one state to the next. And the patients are the ones who notice it because they talk to people across the country through social media, and they can see the discrepancy that so-and-so who lives in this state gets to be taken care of this way, and I, who lives in this other state, doesn't get to. It's difficult, it's scary, it's frustrating, and I am constantly waiting for the other shoe to drop, which is a very tough situation to live in, but I'm willing to put myself in that place of exposure, because if nobody's brave enough to do it, then nothing may ever change.
Exactly. And that is so frustrating. There have been many times where I've managed national sales teams in my careers, and because I'll have people all over the country in different states, all, if there's an issue, whatever the issue might be, they got the flu or they went to the doctor. And then of course you're going to talk in a group thread, and then people are getting different care. And it's baffling. And it's like, okay, well, we all work for the same company. Shouldn't we get the same care? And obviously it doesn't work that way because you're in a different state. Oh, your insurance might not even cover the same thing that my insurance will because you're in a different state. And it's like, it doesn't matter. We both have the flu. Why are we getting treated different when we both have the same symptoms, kind of thing, And I just
Right.
never really could understand that thinking, because that's one of the benefits of working for great companies, as you know, is you're able to offer great insurance, great healthcare, but then you really don't get it when you sign up. And sometimes, as you and I both know, those benefits can be the exact why or the reason why someone accepts that job, and because they want to get that healthcare, and then to find out, oh, it's nothing like what their HR told me at all.
Yeah, it's really frustrating. It's very frustrating. And what I've found is that the doctor is the scapegoat, or the person who's torn in the middle, because we have the patients who are desperate and sick, and they rely on us to care for them. And then we have the systems, the regulatory boards, and the insurance companies that say, no, they put puppet strings on us. And of course, I don't mean people that are doing things that are truly illegal, right? Like submitting false claims or overprescribing narcotics, or I mean, those things are not okay, right? Or just generally practicing bad medicine, wrong drug, right treatment kind of thing. But for people who are like myself, I have written so many policies to put in writing how hard I'm trying to do the right thing by everyone all the time, and it's still not good enough. I get investigated so often. I created an investigator onboarding packet to introduce them. That's not a joke. A welcome letter and an investigator onboarding packet, because I'm so tired of having to justify myself over and over and over again, because they want to control how I practice, and the patients are just desperate for care. But I'm the one in the middle with the license trying to make everybody happy. And all 50 medical boards who are looking at me going, you bad doctor. How dare you not know our law? That was actually told to me by the medical board of a state, which will not be named. And they said, you still your responsibility to know all 50 state laws. I said, well, I can't pay lawyers to read laws all day, every day. Can I? Is that what you want me to do? And they didn't care. They said, well, you have a license. It's your responsibility to know all the laws. The problem's my fault, right?
Yeah, exactly. I'm just
Is that
glad that
gaslighting? I feel like that's gaslighting.
I don't even know where to start. I feel like we could go, that could be a whole nother podcast episode. But I mean, I'm glad to see and that somebody is taking this seriously and somebody is standing up. I mean, as the patient, are we supposed to fight this battle? I mean, it's all we know is we don't feel good. That's what we know. That's our number one priority. We just want to feel good. I don't care what state I live in. I want someone who cares about me. You know, it's, I don't know.
Someday it will be someday you will fight the fight, because one of these days, my megaphone is going to get so big that we're going to start reaching out to people and say, if you want better healthcare, then join me in this, and let's get as loud as we can, because we've seen what happens when large groups of passionate people are willing to come together to fight and advocate for something that is right.
Exactly.
And
Yeah,
we do have the power.
we
We
do.
just have to learn how to flex it, you know?
And come together as a team. And, I think that's the biggest thing too, is setting aside our differences, whatever they might be, but realize what's the bigger picture here? What's the objective? What can we accomplish together? If we set aside those differences and work together for the people to help the people. I love it. And I love that you're doing your Wednesday live Instagrams. Why
Yeah.
don't you tell us where people can find you on Instagram?
Of course. So the little brand name that I go by is America's Favorite Doctor. And the reason why we say that is, all 50 states, patients all across the country. And I genuinely am for the people. Enough people said that to me. You're the best doctor I've ever had. And so it is an ethos. It is a way of existence. It is a way of love and care and putting those things out into the world. So my Instagram is at America's Favorite Doctor, all spelled out. I even have a website too. If you want to become a patient, it's drlaurapurdy.com. And I love, so the Instagram lives are really fun. We have a lot of guests that come on and talk about whatever. We've had actresses, we've had telemedicine company people, we've had clothing line creators, we've had lawyers, we've had all kinds of people on there, and moms, influencers. And what we talk about is whatever we're passionate about. And we find a way to tie it back to healthcare and people or entrepreneurship, empowerment, finding your voice. There's so much that we talk about. And I feel like I learn something every time I have a guest. It is a lot of fun.
Are there any plans, out of curiosity, going back to your musical talents, to have any artists on where maybe you've got like Alicia Keys and you're both playing the piano and you're singing a duet together or anything like that? That would be amazing.
I never thought about that before until just this show when you said that. But now that you've said it, I'm not going to be able to stop thinking about it. I
Okay,
doubt Alicia Keys would
please, you
perform with
have to
me,
do
but
Lauren Daigle.
anybody, I will perform with anybody, literally any singer in the world. I will literally sit, I will sit here and I will play while you sing all day long, and it'll be the funnest thing I've ever done. So
Well,
yes, we'll
yeah,
take applications.
because you don't know their background or what they're going through, or maybe they've been bullied and what their journey was to get to where they're at, to use their music. And yeah, I think that could be a great collaboration, if I'm being honest. A little selfish. That's what
No,
I would like you to
I'm
do.
selfish. I'm like, yes, yes, let's do that.
I love it so much. And I can't wait to just continue to be on this ride and this journey with you to see where everything goes. I thank you for coming on here today and for sharing everything that you're doing, um, and just, giving us a sneak peek into your life and kind of what you've had to go through to get where you're at and to talk about your platform now and what you're doing. And I'm just excited to keep getting everybody on board, and to be educating and kind of getting the word out about what you're doing.
Thank you so much. It's been an honor. I love your energy. I love getting to talk to you. And I believe that our paths will continue to cross as time moves forward. And I look forward to all of that. And thank you so much for having me.
Yes, thank you. Okay. So that was what we did. Is the time went out. So we have like less than a minute and then this is going to shut off. But it was so
Okay.
good to see you again. And I'll get this edited. It should be done in about a couple of weeks. And I'll send you the link once I update it. And I'll have someone do some fun reels of us together for social media. And I didn't know that you were a bully. And so I'm so glad that we got to talking and that came out and we stopped for a minute, because I think for everyone listening that has been bullied, to hear your story and to see what you're doing and to go, she was bullied, I just, that inspiration and that hope. And even to hear that the bullying didn't stop. In fact, it's still happening. That's crazy. Is it just goes to show, like, even if it doesn't stop, it's not that you can't keep moving on and be a source of strength and power and leadership to all those people who have been bullied. And for people that, like, I don't honestly know a lot about it, but to hear